and you're going.
So on the bottom here, it says that it tells you the size. This would be a 4.2 by 11.5 millimeter implant. So this would not be the right one for this case. I'm just trying to show you how you read what the implant is, okay? Legacy 4, and then it's, I think that's 4 millimeters by 11.5 millimeter implant, okay? So that's the implant. When we place the implant, so now we have the hole drilled, and when we place the implant, we use the larger of the hexes. So there's two hexes. Let's call this the 1.25 and the 2.5. Okay? So you use the bigger hex, and that fits inside the implant, and then we just screw the implant in. This hex fits inside the torque wrench. Okay, so we put that on. Not all of our wrenches here fit the torque wrench, so that's what it looks like to fit this torque wrench. So you know. Okay, you put that in there, and now it works. Okay, so then I'll finish that up to, I'll put that in at 35 newtons. The handle comes towards me, I just go like this until it's 35 newtons of force shows up here. See, this separates like this, and that's what stops me from over tightening. Okay, I just use this handle until it gets so tight that the space starts to open up when I pull on the handle. Goes to 35 newtons, and then we take an x-ray. And then when we take the x-ray, we are looking to see that the abutment is tight to the implant and everything looks normal and we're at the right length. Sometimes I'll take it back out if I was short, and I'll drill a little deeper, okay? And then I'll replace the drill. On top of the implant, then we have to go home with the healing cap. And generally the healing cap is in the bottom of the case. This is the healing cap on this one. So all of this will come out, and you take the cap off, the implant out, and the bottom is the healing cap and a screw. And we screw that healing cap on. That one's like 15 newtons. Generally, I just go hand tight with the small hex. So that's our small hex. So when the patient comes back in and it's time to place the crown, it's the small hex, hand tight, that we use to take the healing cap off. And we also use the small hex to place the abutment when we're ready to do the crown. Okay, that's it.